Bottom line, there is no better way than to be prepared with the information and to learn a little of the basics. And that is exactly what this channel is all about. We just got a very interesting post on the forum, and it's from FatMax, and it's talking about, it's really the essence of patient-directed care. If you look up patient-directed care, you'll see a lot of the leading leadership organizations like Harvard, Stanford. I'm sure my old friends at Hopkins are doing some of that, but I really haven't seen that much coming out of there yet. What is patient-directed care? And actually, I wanted to take a few minutes and read through this. But we'll do that in just a minute. First, our introduction. And now. So, FatMax has been pretty active on the channel. I think some of our folks would say he's been sometimes a little bit of a challenge to work with, but still, in the end, he's got some really good information. And I wanted to share this with you because, again, this is the goal, what we're looking for in terms of patient interaction with docs. The last thing in the world that we want is somebody to come in and say, okay, doc, tell me what you want me to do. There's a time and a place for that, but not in terms of chronic disease care. So let's listen to what FatMax had to say. Had first consult with an endocrinologist. She actually suggested that I take metformin to help control blood glucose. My GP said recently, quote, no doctor will prescribe metformin for you. Well, obviously that was wrong. And obviously not the first time a doctor makes a mistake. She, meaning the endocrinologist, she also agreed to my suggestion that I take 10 milligrams of ezetimibe in combination with the 20 milligrams rosuvastatin that I currently take. Now, I'm not involved with FatMax's care. I don't know why he's taking such a high dose of rosuvastatin, but again, that's a side issue, different point. It will be interesting, back to FatMax's thing, it will be interesting to see how all this affects LPPLA2, plaque 2, and the oxidized glycated SDLDL, small dense LDL, particle numbers. I think she was impressed with my knowledge and my diet, lifestyle, medication, self-therapy. I can vouch for that. It's a whole different experience as a doc when a patient comes to me and they know what an SDL, small dense LDL is. They know questions about metformin. They know questions about specifics in terms of therapy. Would you like to get your CINT and labs all coordinated for you and done at one time over a 2-day period? Check out our event. It's going to be in Louisville, November 8th and 9th. So again, it puts you on a different plane of interaction with the patient. I was certainly impressed with her. I showed her a spreadsheet that listed all the relevant lipid and inflammation markers over the past few years, a table of measurements of blood glucose before and after meals, medication and supplements, and metabolic panels. I also gave her, I'm getting old here, I'm sorry, I also gave her copies of all VA, I'm assuming FatMax, that's Veterans Administration, and Quest Labs. All this preparedness made her decisions easy. Let me repeat that one more time. All this preparedness made her decisions easy. She also agreed to prescribe Quest levels of insulin and inflammation and metabolic panels that I wanted. So, I wish things were easier. I wish there were an easy button. And I am working as hard as I can. Spent 3 hours with my team this morning on helping us understand how to get to the next level for developing easy buttons for people that like FatMax and others that are that already know some stuff, but also helping people that have no clue. But here's the bottom line. The way medicine is today, I hate to say it, but it's complicated. And it's not just complicated in terms of the science. It's complicated as a patient to figure out how to get the best thing for you, out of your doctors. And bottom line, there is no better way than to be prepared with the information and to learn a little of the basics. And that is exactly what this channel is all about. Thank you, FatMax. So actually, well, I was going to read my response and intro there, and it's really the same thing that I just said. So you don't want to hear me go on and on. If you've listened to me this far, thank you very much for your interest. And if you'd like, you know what? I keep forgetting to do this. The big thing now is to say, smash that subscribe channel. You know, we're a different generation. Just click it. If you want to smash it, that's up to you. The other thing is, check out our other stuff. Go to our website. We've got a boot camp coming up in Louisville in November 7 and 8. We've got the Access Tour, the CIMT Access Tour coming up over the next few weeks. We're going to get it started, and over the next few months, you'll see us launch it and carry it through. If you'd like to get your city on a CIMT route so you can come by and get one, just go to, I think it's cardiorisk.us/forward. cardiorisk.us/forward. And if you have questions about it, just Google Ford Brewer, YouTube, CIMT Access Tour. Not CIMT Access Tour. Thanks. Hey, if you're interested in a 2-day boot camp type of environment where you get your CIMT, you get all your labs, and we spend 2 days going over the whole thing, check out our event. It's November 8th and 9th at Louisville. Great place to fly into. In November at the University of Louisville.